Hello, my name is Kevin Nicholson, and I'm the Director of Rehabilitation Services at Vibra Rehabilitation Hospital in Amarillo, Texas. Here at Vibra Rehabilitation Hospital of Amarillo, we commonly see patients admitted to our facility with any number of orthopedic diagnoses or other orthopedic problems. This can range anywhere from multiple bone fractures due to some type of severe trauma to a simple lower extremity joint replacement, such as a total knee replacement or a total hip replacement. Additionally, a surgery involving the vertebral bodies and bones or joints of the spine may actually be considered an orthopedic diagnosis as well. And it's specifically the spinal surgeries that I'd like to visit with you briefly about. Now, the focus of much of the treatment that we provide here at Vibra Rehab Hospital in Amarillo will be to improve your mobility and your ability to take care of yourself and to meet your own self-care needs. It's very important. However, we often gear our treatment to deal with other associated problems that may become evident based on our patient-specific individual assessments. This is especially true for those who have had spine surgeries. For example, let's consider the patient who has had surgery of the spine in the lower back. We will often see these patients have a significant impairment in their ability to use their abdominal muscles in a functional way. The abdominal muscles are so important to the stability of your spine. You can consider them your natural back belt or back brace that you have built into your body. When we see this problem, we will implement specific training techniques to start the process of relearning how to use the abdominal muscles to provide that stability to the spine that is so important. Spinal stability, especially in the lower back, you can think of that as a foundation upon which you build a house. If your foundation is very poorly built, the house is probably not going to function very well either. The same with the spine. Once you accomplish that relearning, the ability to use the abdominal muscles to provide the stability inherent to your spine, we will often see a reduction in pain and an improvement in function with simple activities such as rolling in bed, getting up to stand, even getting on and off the toilet. Those types of things can improve simply by addressing those abdominal muscle deficits. So if you or a loved one is considering or being faced with a spinal surgery, I would encourage you to speak with your physician to see if you will have a need for inpatient rehabilitation services following the surgery. Thank you very much.